August is National Immunization Awareness Month. Josh Lederman is here in the studio with information on what parents need to know. Josh?
Tay, every year around this time, public health officials remind parents to make sure their kids' immunizations are up to date. As one official said to me this week, 30 kids running around a classroom is like a petri dish. But in spite of all that, parents still find they have a difficult decision to make.
Ready, set, go!
Elise Anders and her husband spend a lot of time chasing after their 3-year-old son and taking care of their 3-month-old daughter. She says one of the things keeping them happy and healthy is vaccinations.
They're really, really important, and the push to stop immunizations right now and to scare people from getting them is really, really dangerous.
With limitless information on the internet, it can be hard to decide how important vaccines really are.
You hear in the news how certain diseases we thought that we obliterated are actually making a comeback. And last year, I think it was the mumps. This year, we're hearing about pertussis, whooping cough.
According to public health experts, Chicago saw 13 cases of whooping cough in the last 4 weeks, compared to only 7 in the same period last year. In California, 6 people have already died from it this year.
One of the things about vaccines is they're victims of their own success. Because we don't see these diseases, we don't think they exist. However, that's really not true.
Much of the uncertainty about vaccine safety stems from a 1998 study showing a link between vaccines and autism. That study was recently discredited, and the doctor responsible lost his medical license. But concerns remain.
Concerns are that there seem to be some scientific support for vaccinations leading to higher rates of autism.
Ward Hayes says she doesn't know which side is right. She isn't a mom yet, but if she becomes one,
I probably would talk to the pediatrician that I choose, and then maybe a few other doctors.
medical professionals recommend immunization starting during infancy, but most schools require vaccination or a religious or ethical exemption to enroll. Tay?
With all the contradictory information going around out there, what should parents believe?
Well, the Mayo Clinic urges parents to immunize their children as early as possible. Now, any vaccine can have side effects. They're usually pretty minor. You might get a headache or have some fever or soreness, but rarely there can be more extreme reactions. But the Mayo Clinic says getting a vaccine is always safer than getting the disease that you could get if you're not immunized. And about those autism rumors, the American Medical Association, the American Academy of Pediatrics, the CDC, they all say that there's no evidence that vaccines contribute to autism. Tay?